No one wants to be caught flat-footed, but for some people, it's a permanent and uncomfortable position that could impact their well-being. Here's the latest in this week's Positively Healthy. Having flat feet is not altogether uncommon. Many people have it and are still in good standing.
10% of the population is born with flat feet. 20 years ago, it was enough to get you out of the military. It's no longer the case because it's actually normal. What is not normal is when people have a normal arch and then the arch starts to collapse.
Dr. Christina Kabash is a board-certified orthopedic surgeon with a specialty in the foot and ankle. Managing what's called an acquired flat foot falls into her expertise.
So an acquired flat foot deformity tends to be painful, can cause swelling, deformity. When the arch collapses and tears tendons and ligaments along with it, that's a painful flat foot.
As we age, our feet carry the burden, getting longer and wider as the foot flattens. Being overweight also exacerbates the condition.
So the pain generally starts on the inside of the arch or the ankle. So over time, as the ankle starts to collapse and fall in, the foot spins out and that pinches the tissues on the outside of the ankle.
If caught and treated soon enough, arch support may remedy the problem.
What the arch support will do is help correct the position of the foot and hopefully let the tendons and ligaments heal in the proper alignment. It can never replace it, and once the foot has started to collapse, arch supports will be a lifelong requirement.
People with painful fallen arches should move quickly before additional treatment is required.
Unfortunately, once it's too far gone, then you need to either work with bracing or possibly surgery.
The most complete fix is an operation to rebuild the arch.
But once it gets beyond the ability of an arch support to support the arch, then it involves getting a brace. If we catch it soon enough that there's not a lot of arthritis in the foot, we can usually have a brace that has a little bit of a hinge to it. And sometimes we can use that brace for up to 7 months and then wean you back into an arch support. If that's not the case, then you have to decide whether you want to have lifelong bracing or go on to surgery.
With so much riding on our feet, doctors say it's important to take corrective action.
Absolutely. So with a painful flat foot, if you do nothing, it hurts, you limp, you don't get around much, and you don't exercise much. People can't go on their daily walks. Once you fix this, you tend to pretty much get back to everything you were doing before.